This is Chapter 32, Environmental Emergencies. So an environmental factor such as temperature, atmospheric pressure can definitely overwhelm your body's ability to cope with its surrounding, and then that leads to medical emergencies. Certain populations are definitely at higher risk: children, older people, those with chronic illnesses, and then young adults who just overexert themselves. They often accompany other illnesses or injuries that require treatment at the same time. It's generally not just isolated to an environmental factor. Such things are like heat and cold related emergencies, water emergencies, pressure related emergencies, such as like diving or high altitude climbing, injuries caused by lightning, and then envenomation because of bites or stings. Factors that affect your exposure um, depends on a lot of things. Physical condition: patients who are ill or in poor physical condition won't tolerate extreme temperatures as well. Age definitely affects how a person deals with environmental problems. Children and older adults are more likely to experience temperature-related illnesses. Infants have poor thermoregulation and the inability to shiver. Children may not think to or may not be able to put on extra clothing to protect themselves. Older adults have less subcutaneous tissues, which reduce their overall insulation, as well as poor circulation due to the aging process, and then medications that can affect thermoregulation. Nutrition and hydration status: a lack of food or water will definitely aggravate the stress put on the body by temperature extremes. Calories provide fuel to burn, creating heat during the cold. But if you aren't eating, then you don't have that. Alcohol will definitely change the body's ability to regulate temperature. Having water, proper hydration provides for sweat so that it can evaporate and remove heat. So if you don't have that, it can be an issue. Environmental conditions that can complicate, sometimes improve environmental situations, but it depends on what the situation is, like air temperature, humidity level, and wind. Extremes in temperature and humidity are not needed to produce hot or cold injuries. Most hypothermia occurs at temperatures between 30 and 50, so it's not like a severe cold. Most heat stroke occurs when the temperature is around 80 and the humidity is 80%. And sometimes just normal temperatures if you're vulnerable. So, like older people may not be able to heat or cool their homes effectively. Cold exposure: if the body or any part of it is exposed to cold environments, temperature regulatory mechanisms may not be effective. Cold exposure may cause injury, especially to your feet, hands, ears, nose, and then you can, of course, have hypothermia of the entire body. There are 5 ways in which the body loses heat. So, conduction is direct transfer of heat from one part of a body to the colder object. Convection is transfer of heat circulating in the air when cold air moves across the body. Evaporation is conversion of any liquid to a gas. So this is your natural sweating mechanism to try to cool off the body. Radiation is transfer of heat by radiant energy, but you get this more like when a warm person stands in a cold room. And then respiration: so you do lose body heat just by normally breathing. Warm air comes into the lungs and then is exhaled into the atmosphere. The colder air of the atmosphere is inhaled when you breathe. The rate at which you gain or lose heat can be modified in 3 major ways. Shivering is going to increase heat production. Increasing movement will increase heat production, and then the exact opposite: decreasing and limiting movement when hot. Moving to an area where heat loss can be decreased or increased, so seeking shelter from the wind in cold environments and seeking shade in a hot environment in order to try and cool the patient down. And then wearing appropriate clothing for the environment. Layers of clothing provide good insulation. Protective clothing traps perspiration and prevents evaporation, or you can loosen or remove clothing in order to cool down. Hypothermia is when your core temperature falls below 95 degrees Fahrenheit or 35 degrees Celsius. This is when you're talking about your temperature of like your heart, your lungs, and your vital organs. That's your core temperature. The body then loses the ability to regulate its temperature and to generate body heat. The physiology, your body tries to protect against this heat loss by constricting the blood vessels in the skin, which then you get the white to bluish fingertips. The body shivers to generate heat. As soon as all of these mechanisms become overwhelmed, your body function starts to slow down. Your mental status deteriorates. All of a sudden, your key organs, such as your heart, is going to slow down, which then leads to death. Hypothermia develops differently depending on the environment. So if you're in cold water, like immersed in cold water, that for sure is going to make it develop faster. The colder environment that's not water-based is going to be more developing gradually. Air temperature does not have to be below freezing for hypothermia to occur. Your people at risk, homeless people and those with homes that lack heating mechanisms, swimmers, even in the summer, geriatric, pediatric, ill individuals who are less able to adjust to temperature extremes, patients with particular injuries or illnesses such as burns, those in shock, those with a head injury, those that have had a stroke, those with generalized infection, injuries to the spinal cord, diabetes, hypoglycemia, and then patients who have taken certain drugs or are on alcohol. Signs and symptoms become more severe as the temperature continues to fall. It becomes more evident the further it goes down. Hypothermia progresses through 4 general stages. So you've got a table, 32.1, that kind of talks about those, but there's really no clear distinction between the stages. But different signs and symptoms definitely help you estimate the severity of the problem. You want to go ahead and assess the general temperature, so you can put the back of your glove, pull up the back of your glove and place the back of your hand on the patient's abdomen. If the abdomen feels cool, the patient is likely experiencing a cold emergency. You may carry a hypothermia thermometer, which registers lower body temperatures. Typically, we don't have them on the ambulance. Mild hypothermia occurs when the core temperature is between 90 and 95. The patient is usually alert, shivering, pulse rate and respirations are usually rapid. Skin may appear red, pale, or cyanotic. When you start getting below 90, then that's pretty severe hypothermia. Shivering stops, muscular activity decreases. Eventually, all muscle activity is going to stop, and your mental status is definitely going to decline rapidly. As the core drops down to 85, the patient becomes lethargic, stops fighting the cold, level of consciousness decreases. The patient may actually try to undress because they're so cognitively impaired. Poor coordination and memory loss follows, along with reduced or complete loss of sensation of touch. Mood changes occur. Patient shows impaired judgment. They become less communicative. The patient experiences joint or muscle stiffness. They have trouble sleeping or speaking, and they appear stiff or rigid. If the body temperature falls to 80 degrees Fahrenheit, vital signs slow, pulse becomes slower and weaker, respiration slow to shallow or become absent, and cardiac dysrhythmias may occur as the blood pressure decreases. At a core temperature of less than 80, all cardiopulmonary respiratory activity may cease. Pupillary reaction is slow. Patient may appear dead or appear to be in a coma. Never assume that a cold, pulseless patient is dead. Actually, with active rewarming, you can bring them back to proper functioning. Local cold injuries are confined to exposed parts of the body. The most commonly injured areas are the extremities, especially the feet and hands themselves, ears, nose, and then other portions of your face. When exposed body parts become very cold but not frozen, the condition is called frostnip. When chilblains or immersion foot or trench foot, when the parts become frozen, then it's actually called frostbite. There's several different factors that determine the severity of that local cold injury: duration of the exposure, temperature to which the body part was exposed, and then wind velocity definitely makes things different. You also need to investigate a number of different underlying factors. So, was there exposure to wet conditions, inadequate insulation from the cold or wind, restricted circulation from tight clothes or shoes, or circulatory disease, fatigue, poor nutrition, alcohol or drug use, hypothermia overall, diabetes, cardiovascular disease, and age. Patients with hypothermia should be assessed for frostbite or other local cold injuries. Local and systemic cold injury problems can occur in the same patient. Frostnip and immersion foot or trench foot. After prolonged exposure to the cold, skin may freeze while deeper tissues are unaffected. Usually this is going to be your ears, your nose, your fingers, usually not painful, so the patient's not really aware that the cold injury has occurred. Trench foot occurs after prolonged exposure to cold water, common in hikers or hunters who stand for a long time in a river or a lake. Your skin is going to become pale, blanched, or cold to the touch. Normal color does not return after palpation of the skin. That's what blanching is. The skin of the foot may be wrinkled but can also remain soft, and the patient reports loss of feeling and sensation in the injured area. Frostbite, definitely the most severe local cold injury because the tissues themselves are actually frozen. Freezing permanently damages the cells, but the exact mechanism of how that happens is really not well understood. Gangrene is permanent damage or cell death, requires surgical removal of the dead tissue, so that black portion at the ends of his fingers is dead and needs cut off, unfortunately. The exposed part becomes inflamed, tender to the touch, and unable to tolerate exposure to cold. Other signs and symptoms. Most frostbitten parts are hard and have a waxy appearance to them. The injured part feels firm to frozen as you gently touch it. Blisters and swelling may appear. In light-skinned individuals, a deep injury that has thawed or partially thawed, that skin is going to appear red with purple or white, may look kind of mottled or cyanotic, and the depth of the skin damage will vary. With superficial frostbite, only the skin itself is frozen. With deep, those deeper tissues obviously are frozen, but it's hard to tell deep from superficial. For your patient assessment, regardless of its severity, consists of stabilizing the ABCs and then preventing further heat loss. So you're seeing size up, seeing safety, and then noting weather conditions, air temperature, wind chill, is it wet or dry? Make sure that the scene is safe for you so that you don't become a casualty as well. Identify safety hazards such as icy roads, mud, wet grass. Summon additional help as quickly as possible, and look for other indicators of a mechanism of injury. For your primary assessment, form your general impression, doing your rapid scan so you can find any life threats if they're there. If the chief complaint is simply being cold, try and assess how cold the patient is. Remember, you can take that back of your glove up and feel the skin on their abdomen. Evaluate their mental status using the AVPU scale. A altered mental status indicates the intensity of a cold injury. Obviously, the more altered they are, the worse the injury actually is. We'll go on here in the next video.